Welcome back. April is National Oral Health Month. To give us some tips on how to keep our mouths clean and so much more, well, she's a dentist, so she knows all about it. Dr. Jessie McAllister with McAllister Dentistry. Nice to have you here, Doctor.
Thank you for having me.
Can you tell me about McAllister Dentistry? So it hasn't been around too long.
We just recently opened our office in the East End of Ottawa.
Congratulations.
And, I've been practicing here in Ottawa for the past 7 years, but I finally opened my own office.
Where exactly in the East End of Ottawa?
It's at Blair and Ogilvie.
All right. Okay, we've got plenty of tips here. Now, can you tell us the importance of the month? Why is there an oral health month? Are we just that bad at keeping our mouths clean?
No, it's just to raise awareness, mainly looking at how oral health can impact our general health, our overall health. So it's about educating patients and the community, you know, in order to care for their health and make sure that they stay healthy.
Because we'll get into that in moments, because people don't realize that your oral health reflects on other parts of your body.
It definitely does,
okay.
Yeah. There's been several studies linking, you know, uncontrolled diabetes with periodontal disease and vice versa. Also, oral health and heart disease and respiratory illness as well. I
didn't know all that. Okay, now it makes me feel like I should brush my teeth.
Well, we can help you with that. We have some good tips today.
Well, you do have some tangible steps to improve your health overall. So I know you brought a bunch of stuff.
Yeah.
Do you want to go through some of the tips?
Sure. So first, I mean, I think all dentists will tell you, floss. There's no way around it. There's no sugarcoating. You have to get in there. You have to use the floss. There's some extra tools that we can use. You have these little flossers too that make it a little bit easier for kids or for patients that have manual dexterity issues. That can help for the aging population. And, you know, looking at investing in the right toothbrush can be a huge advantage. And then also leading a healthy lifestyle, and which includes eating right and having a healthy balanced diet. So
let's get to the food in a second, but can I ask you quickly about flossing, because I know dentists are always on you about flossing. Now, how often should you floss? Because I find sometimes when you do floss, it hurts after a while. You get into the gums and maybe a little bit of blood starts happening. How often is it healthy to floss?
Well, we recommend flossing daily. Every day. When you see a little bit of bleeding and a little bit of tenderness in the gums, it means that those gums are inflamed. So the more you floss, the less you'll see that bleeding. So just keep doing it as much as you can. You want to be gentle. You want to wrap the floss around the tooth and gently go under the gum line. But every day is what we recommend.
I basically just told you that I don't do it very often.
That's okay. It's a very common thing. Not everybody's flossing every day, and that's why it's important to invest in the right tools. So, you know, if your toothbrush looks like this at home, all the bristles are sort of splayed, it's not doing a good job. The manual toothbrush can be great if used properly, but a lot of patients are brushing too hard, maybe in an attempt to make up for the lack of flossing, so they're scrubbing a little bit more at the gum line and things like that. So that's why I really recommend picking up a good electric toothbrush.
An electric toothbrush?
Yeah, so an electric toothbrush can be great because it sort of does all the work for you. So this one here is from Philips Sonicare, and this is the one that I recommend to my patients. So you are investing in it. You know, these prices are actually fairly reasonable. They start at about $85. And we actually have coupons that you can pick up at your dental office, where you can go and buy it at most major retailers. But the advantage of this particular electric toothbrush, Philips Sonicare Protective Clean, and it says it in the name, it protects. So the biggest problem I see with my patients is that they're over-brushing. So we see a lot of gum recession as a result of that. And this one is really gentle, so it doesn't do that. It keeps your gums healthy. It actually helps to keep your teeth white because it will remove those surface stains right off your teeth, and it does all the work for you. And really, I mean, patients are concerned that an electric brush is going to be too aggressive, but it's actually the opposite. This is the most gentle one that you can get. It helps to protect your teeth.
And when your gums recede, they don't come back.
They don't come back. So I actually found that when patients switch over to the electric toothbrush, the gum recession stabilizes. Yeah, and it's safe to use. Patients ask me all the time, is it safe to use on my dental crowns or veneers? It's 100% safe to use on those areas as well. And you know, it gets a really effective deep clean.
Okay, what about the foods then? Because obviously you've got different liquids that look dark, so they're probably going to stain up your teeth.
Yeah, so sometimes we'll get staining from things like coffee, tea, and sodas as well. The carbonation in the soda is also damaging on the enamel, and lots of sugars. There could be up to 11 teaspoons per serving in different Cokes and things like that.
But gummy bears can't be bad
Gummy
for you,
bears,
can
so
they?
yeah, so gummy bears are that sticky,
they help clean your teeth, don't
any
they?
sticky candy that will get stuck in your teeth, that's not great. That's going to sit there and form cavity. And of course, chocolate, anything with a lot of sugars, added sugars and things like that will cause cavities.
So what about vegetables then? Because obviously you have a lot of healthy looking stuff. So not only healthy for your insides, but healthy for your teeth.
Exactly.
Yeah.
So these are foods that will be healthy for your teeth. Well-balanced diet, again, we want to look at some leafy greens. Anything with a lot of fiber is going to cause you to chew more, and that's going to increase the saliva production, which will protect your teeth. Carrots are a nice, crunchy, healthy snack as well. Almonds and a handful of nuts, they actually has a lot of calcium in there and magnesium, which can help build strong bones and teeth. And as well, cheese, obviously we know dairy products, calcium, helping build strong bones and strong teeth as well. Yeah.
What are some of the healthcare trends that you've seen when it comes to oral health over the years?
Well, so like I mentioned before, gum recession is a huge thing that we're seeing. Patients are always concerned, wanting to whiten their teeth and things like that. We're seeing a trend towards more adult orthodontics as well. So patients deciding that they want to have braces later in life. And again, that's what comes back to choosing the right tools to make sure that you keep your mouth healthy. And so one of the things actually that the Sonicare brush does, I just wanted to demonstrate for you, if I can, it creates these little micro bubbles, which gets deep beneath the gum and between the teeth, and that really flushes out all the bacteria and makes sure that everything stays clean inside your mouth.
Which is pretty darn important, especially when it's
very important.
When it's National Oral Health Month.
Right.
I'd say that's some important tips. Where's your location one more time quickly?
We're located at Blair and Ogilvie, 2016 Ogilvie Road.
Dr. Jessie McAllister, thank you very much for all the helpful tips.
Thank you.
We've got more daytime coming up in moments on Rogers TV.